State leaders are urgently searching for a solution in hopes of saving a Central Valley hospital. Madera Community announced today it plans to file for bankruptcy and close its doors. This comes after a potential sale of the hospital fell through. First responders and city leaders are speaking out about the impact on residents' care. Action News anchor Jessica Harrington is here in the studio tonight to explain how this happened and the pressure it could put on the ambulance company in Madera County. Jessica?
Margot, a member of the hospital board of directors, is giving insight tonight. He says the bottom line is the potential buyer and the attorney general's office could not reach an agreement to allow the purchase to move forward. Now, without some sort of intervention, the hospital will be shutting its doors in less than 2 weeks, forcing people to get critical care elsewhere.
The hospital that celebrated 50 years of service in 2021 is now planning to close its doors for good unless something happens fast. Robert Poitras serves on the Madera County Board of Supervisors. He's also a member of the Board of Directors for Madera Community Hospital. He says the hospital serves mostly Medi-Cal and Medicare patients. That comes with a low reimbursement rate from the state. Then, over the pandemic, he says many longtime nurses retired. The hospital had to fill those positions with traveling nurses at more than 3 times the rate of pay.
With these low reimbursements and this high rate of payment of traveling nurses, it's just tanked us.
So the hospital looked for a buyer or partner. St. Agnes Medical Center in Fresno, owned by Trinity Health, showed interest and started the process. The California Attorney General's office had to sign off on the sale and released a list of requirements in order for it to move forward.
Trinity, the parent company of St. Agnes, came out with with what they were willing to do. And then the Attorney General came out recently, 10 days ago or 2 weeks ago, with whatever their conditions were. And unfortunately, there was a big gap.
St. Agnes released a statement saying in part, quote, "Unfortunately, given the complex circumstances and the additional conditions imposed by the AG, it became clear we could not move forward." The AG's office also released a statement saying in part, quote, "Any deal without those conditions would make the hospital one that would not serve or help the community." Without a sale, the hospital plans to file for bankruptcy and close its doors on January 3rd. Service in the ER, delivery room, surgery, and outpatient will close at that time. Clinics will close on January 10th. The looming closure is putting pressure on other first responders. Ted Pistoresi, who owns Pistoresi Ambulance, says his response times could slow as patients are taken to hospitals further away.
If we have all of our ambulances in Fresno taking 2 or 3 hours to get back, it's going to affect, the ability to provide service here because we're just not going to have ambulances.
David Bocci, the regional vice president with the Hospital Council, says the impacts of the closure will be felt well beyond Madera County. Patients will fill beds across the Central Valley, meaning longer wait times and further travel for care.
Depending on where in our region people are seeking care, this potentially could be a difference of 70 miles or more that they would have to travel.
The Board of Supervisors is planning to hold an emergency special meeting next Thursday to discuss what steps to take next. The exact time of the meeting will be released next week, but officials say this is something that needs to be discussed as soon as possible. Live in the studio, Jessica Harrington, ABC 30 Action News.